People with limited hand function can use Tenodesis to hold glass or bottle, manipulate utensil or tool, assist with dressing tasks like pulling on cloth, occupational therapy, training focus on adaptive strategies to make Tenodesis a reliable tool for independence, exercise, practicing controlled wrist extension with various objects to improve grip, overstretching the flexor tendon. Overstretching the flexor tendon can reduce the effectiveness. Overstretching the flexor tendon can reduce the effectiveness of tenodesis grip. The therapist recommend avoiding activities or stretches that extend the finger when the wrist is also extended. Proper splinting and positioning to preserving tendon integrity during rehabilitation. Tenodesis. Tenodesis refers to Tenodesis refers to functional relationship between wrist position and finger movement. Functional relationship between wrist position and functional movement due to natural tension in tendon that control these movement used in rehab and surgical procedure. When the wrist is extended, the finger naturally tend to flex. When the wrist is extended, the finger naturally tend to flex. When the wrist is flexed, the finger naturally extends. This is due to passive tension in the flexor and extensor tendon. Due to passive tension in the flexor and extensor tendon. In rehab with spinal cord injury, utilizes tenodesis to enable functional grip. In controlled wrist extension to curl the finger. In tenodesis surgery, tendons are surgically anchored to restore or enhance function in case of tendon or joint damage. Tenodesis grip is an adaptive functional mechanism where individual with limited finger movement quadriplegia rely on wrist extension to achieve a grasp. In spinal cord injury C6-C7 level, finger flexion extension impaired, wrist extension may be functional. Tenodesis grip for tasks like holding utensil, picking object, extending the wrist to passively curl the finger into a grip. Extending the wrist, passively curl the finger into a grip. Rehabilitation focus on strengthening wrist extension, preserving passive tension in the flexor tendon. Patients are advised to avoid overstretching their finger flexors. Avoid overstretching of finger flexors. Avoid overstretching of finger flexors. Specialized tenodesis splint or orthosis to assist with wrist extension and finger flexion.